Chair. Morning, Minister. Morning, officials. Minister, and this can be provided on notice if needed, would you provide an updated implementation plan for the Royal Commission's recommendations, including the revised timeframe for implementation and a rationale on why recommendations have been delayed, reversed or scrapped entirely?
Thank you for your question, and obviously implementation of the Royal Commission's recommendations is a key focus in the mental health portfolio and across my department. And I would say from the outset that it is a huge undertaking. It is a very complex and detailed implementation program that we're pursuing, but one that is critically important. And I think it's fair to say that there's no other jurisdiction in the country that's doing as much reform in the mental health space as we are here in Victoria. It is a bold reform agenda, and this budget alone invests $500 million to progress a number of those really important recommendations. And the government has, since 2021, invested over $6 billion. Many of the foundational reforms were part of the early work of the government. Last year I released the next phase of reform report, which will help guide not only the focus of my department and government decision making, but also gives the sector that certainty that they were asking for in terms of the phasing and the order in which we do the next.
Have you got that plan? Just in the interests of time, we've got quite a few questions and I'm happy to take it on notice, just the implementation plans, where we're at, how many have been scrapped, delays?
Ms Benham, that report, the next phase of reform plan, was released publicly in December, so that's already available. I'd be happy to provide that
would be great.
to you, but it is on the Department of Health website. I can indicate that of the 74 recommendations, and bearing in mind that each of those 74 recommendations many of them have got lots of sub-recommendations. They're
That's
quite
why
complex.
we're after a detailed report.
I can
Get
report...
a really detailed...
Yes, I can report that the work on that, we've either commenced or completed 68 of the 74 recommendations, which is a power of work. I'd also just...
Do we have a date on when the remaining 6 will be complete?
Well, the Royal Commission, when they handed down their final report, indicated that there would be a 10-year reform period of time required to deliver this level of change to the system. And I think that whilst progress has been really strong, there have been a couple of more of the complex recommendations that have taken a bit longer than we thought.
Yeah, these reports have been provided to PAYAC every year, so if we can get another copy of that report, that would be fantastic. Minister, I'm going to move on from there. Can you please provide an audited report on the expenditure too of the mental health surcharge or the mental health tax since introduced and the coming budget year?
Thank you, and of course the mental health levy has supported a large amount of reform, and it's increased the investment in Victoria's mental health system since it was introduced in 2022. The levy continues to be solely dedicated to mental health services spending, and that's...
Sorry, Minister, wasn't the levy was brought in to solely fund the Royal Commission's recommendation implementations, true?
The mental health levy was a key recommendation of the Royal Commission. The Royal Commission...
Fund those recommendations?
The recommendation was around making sure that we had a mechanism to deliver the kind of significant uplift in investment that would be required to deliver all of the reform that the Royal Commission called for. And what I can indicate is that if you look at Budget Paper 5, page 19, you will see that the levy will collect more than $1.1 billion in 2025-26. And the levy each year is reported through the normal budget process.
Minister,
but
this
the
is-
investment...
we're after, given this is budget estimates, I'm after a detailed breakdown of that spend. And again,
Well,
happy to take that on notice.
No, I don't need to take it on notice. I can answer that for you now. In addition, under the Act, the Mental Health Act that we introduced in 2022, the Chief Officer for Mental Health and Wellbeing must submit to me an annual report which details how the proceeds have been spent on delivery of mental health and wellbeing services. And Ms Benham, that report's publicly available each year.
Okay, again, it's one of those things that we've been requesting year on year, and again requesting detailed breakdown of that $1.1 billion spend each year. If we can get a copy of that, that would be great, so we can get a broad scope.
I'm happy to provide it, but it's already publicly available, and it's delivered each year to me by my department, by the Chief Officer for Mental Health and Wellbeing. And I think what's really important here is to note that more than double our mental health investment has been possible since 2017-18 because of the introduction of the levy. And that has meant that we've been able to double the investment compared to immediately prior to the Royal Commission's report being tabled. So this is a good thing for the level of reform that we are seeking to deliver.
Right, are you able to provide that report to the committee, please?
I'm
We're
very
just wanting
happy
to
to,
see
Ms
where
Benham,
the
but
$6 billion, we need much more detail than what we're able to get in the 8 minutes that we've got allocated.
Ms Benham,
we want to see where the $6 billion to implement the Royal Commission's reforms is being spent. This is budget estimates. This is exactly what it's for.
Yes, and I respectfully have been indicating that we do that each year
Right,
through
can
that
you send us the
process.
report?
It's publicly available on the Department of Health website, but I'm very happy to provide that to you.
That would be
in addition
great.
to that.
Fantastic. Have you ever? Are you across? Are you across where the mental health tax is being expended and making sure that it is? There are suspicions, again, that it's being used to prop up core government services within the Department of Health.
Well, no, I would reject that assertion. As I've indicated, we're expected to collect about $1.1 billion in
But you understand our need for
2025.
a very detailed breakdown of where the spend
It's available
is being spent.
online. You can Google it.
I'm attempting to answer your very specific question, and I want to give you this detail because it is important. 1.1 billion will be collected in 25-26, but our total investment in the mental health portfolio this financial year alone is $3 billion.
don't have
Thank you, Minister. Ms Benham, we will be swinging back your way.